Hello, everyone. My name is Shelby Perry, and I am here today to bring you my podcast, Health Chat with Shelby Healthcare for Human Rights. This podcast is a space for those individuals inside and outside the healthcare industry to understand the problems healthcare providers and first responders face every single day at work. So, hello, and I would like to welcome all of you to my first podcast for Health Chat with Shelby. Today's episode is called Healthcare for Human Rights. But before I jump into this conversation, I want to let you know that during this conversation, we will be talking about human trafficking, so viewer discretion is advised. The goal of this podcast is to bring awareness to human trafficking in Rhode Island. And today I will be speaking with Kat and Oscar. With that being said, I hope you guys enjoy this episode. So, Kat and Oscar, can you guys introduce yourself, tell the audience who you are and your work? Yeah.
Well, hi everyone. My name is Oscar. I'm from Mexico City, Mexico. And I just wanted to say that because sometimes people think I'm from Mexico, Maine, which I didn't even know that there was some Mexico, Maine until some people are like, oh, I'm from Maine too. It's like, no, I'm from Mexico City, Mexico. I've been working in the field of human trafficking for the last 12, 14 years. Right now up here in New England, I am the outreach coordinator with the New England Coalition Against Trafficking. And also nationwide, I do the the training and field building lead at Collective Liberty, which is like a nationwide organization that provides support for service providers and law enforcement and disrupt strategies against trafficking.
And my name is Kat. I also have worked for the last 14 years against trafficking in all different capacities, from education to providing survivor care and response and education programs, and helping service providers create a more survivor-centered approach. I currently do oversee the CSEC cases for one of the local counties, and I also am part of creating a new program called Legacy RE, which is aimed to provide first response care for survivors and advanced human trafficking institutes for service providers, but also self-care for service providers.
Awesome. So I focused a lot of my research the last couple of months on the lack of awareness, proper care provided to those survivors, and how to better educate first responders and healthcare physicians. Have you guys noticed that there is a lack of awareness and training?
I think there's one thing I could say is that we cannot not say we are enough trained on human trafficking. Human trafficking evolves every time, and the way people are being trafficked 2 years ago is not the same that is happening right now. So I would never say that we're enough. I'm trained, I don't need more training. So there's always a big need of training into that issue. And also one thing that I've said in the US is that we kind of are good creating awareness and human trafficking 101, but I don't see what's the human trafficking 2.0 and what's the next step. And I think there's a big need on, especially of that specific kind of trainings when we talk with service providers.
And I think there's been a big push to create education. One of the things that I say, I think, like Oscar said, is it changes rapidly. I think the way that exploitation and trafficking happens, the language that's involved over the last 12 years has changed so much, and it's advanced so much, and it's been more survivor focused, but still has a long way to go. I think there's been a lot of push for 101, basically how to do it, but I think sometimes people recycle the same information.
Yeah.
And so it becomes really like, it becomes not almost rehearsed, but it's like a lot of the same information. And I think some of it's really good, but some of it has been a little bit outdated, or there could be things that now should be added and adjusted. But I also feel like sometimes the information is pocketed. You'll find a lot of information and awareness in larger cities where there's larger hospitals or first responders, but as you start branching out to smaller locations and smaller towns, there's really disparity between who's actually receiving education, when's the last time they received it, but also too, I think, who also is giving the information, I think, creates a different change. And like Oscar said, is we've seen a lot of 101s, but that getting the overall human trafficking scope and the actual individualized practice and application in the work, I think there's still a long way to go. And I think also there's the ways that trafficking happens, the different methods, the things that you see, the trends change so rapidly. So I think it's not something you can be trained in once and think, oh, I got this. I think there needs to be a constant education. I think it's been amazing to see how much people have now, 12 years ago, people were like, what?
Yeah.
Oh, it's good what you guys do far away. And now they're like, oh, I know about it. But you're like, no, really, you don't. And so I think having conversations about what it looks like, because I think what it looks like in urban cities, what it looks like in small towns, there's things that are commonalities, but even within the same city, you're going to have all different dynamics.
Yeah.
So I think understanding the scopes of all the different dynamics that go into all the forms of trafficking, but also too, I think understanding and educating that you can have people who are experiencing exploitation by the same person exploiter, but each trauma response is going to look completely different.
Yep.
And so if you box in what you think it should look like, the response will look very individualized. And so I think if we're only looking at one narrow lens of here's all the red flags, here's the screening things, we're going to miss a whole group of people who aren't responding that way.
Yeah, that's great. So I know you guys said that you have worked with first responders. Was there something that struck your eye to make you want to work with them specifically, or was that something you just always wanted to do?
Well, I think when I work against trafficking, I like to see the whole picture and see all the actors that take place.
Yep.
And I think first responders are fundamental. And the way trafficking works also, I think the interaction that people being trafficked have with first responders, it's crucial on if they're going to go back into a trafficking situation or if they're going to keep forward moving towards finding resources. So I think it's crucial for ending up for disrupting human trafficking.
Yep.
It's crucial that we have service providers well trained, because the interaction that they will have with the victims, it's going to be crucial for them to move forward or to go back into their trafficking situation.
So do you think interaction with first responders is different than healthcare providers, or?
And I would say, so for me, my thought is this, one of the reasons we want to work with both first responders and medical, I would say the interaction is completely different, and I'll explain a little bit more. But why do I think we need both and why we're passionate about it is about now 14 years ago, I had a little girl who was 12 years old, and she had said to me, hey, Kat, if traffickers can work together like a finely tuned network, and they can put aside their agendas to move us all over the place, even though they might disagree, why can't the community? And I think that the response of trafficking can't be isolated silos. You need all the multidisciplinary practices working and communicating together, and also knowing here's my specialty, here's my response, and here's where my role ends, and then I pass it on to someone else. And by working finely together, both first responders, medical responders, hospital staff, EMS, that finely tuned network, and then also them passing it off to law enforcement, each interaction will help the process go a little bit better, but also help the healing and the whole response. But with only one or the other, if they're all isolated silos, it's not going to provide the holistic response, but also it's not going to provide the survivor-centered care, and it's not going to change the circumstance. So I think,
even though if that's something that we are talking that much in the anti-trafficking world, I think sometimes as much as we say they are trauma-informed, survivor-trained, I think could be not having the first responders, the healthcare people trained on trauma, it could re-traumatize and being a bad experience, knowing that a lot of people that are being trafficked, they already have crossed, while being trafficked, they already have crossed with healthcare providers. And sometimes it could be a really traumatic situation too.
And I think too, one of the things first responders talking about, EMS and fire departments and things like that, their role is very different in their interaction when there's an emergency. And I think a lot of times, we might have our red flags, but human trafficking can look like a DV situation. We've had a lot of survivors that we love and really care about who are like, man, I interacted with the police and law enforcement. We've had survivors be like, hey, I had to fight that ambulance person because that person, the exploiter, was watching me. And if I didn't fight and it looked like I was going willingly, that would put me in a situation. So changing that perspective of, man, we think in a silo of oh, this is what trafficking should look like, but how it overlaps with different situations, or maybe you're responding to a home and for us, it was man, we have a lot of friends who are survivors, and we see how they're interacting, and there are things that are being missed that, man, if people just had the opportunity just to be like, here's all the different responses. And I think the last institute we did, we were really moving forward last year with a lot of first responder and healthcare trainings. Our last one was 6 hours in December, and we had it planned our follow-up for March, and everything kind of fell through from COVID. But we had like 156 EMS in the room, and we pulled cases from that area. And showed them like, here's okay, we're going to educate in human trafficking, but let's pull real life cases, and then giving that alert to change the perspective of how you see. Maybe you see someone responding with a different trauma response, or you see somebody else not engaging. What are the different things that could be? But also, like, you're trained in this one narrow vision, but what does it look like to oversee that? And I think in the medical aspect, you have a really unique situation, because there are times where they're going to be alone. And maybe not that first time. I think everyone has that idea of like, oh, that first time I'm going to be able to do that. But by building that relationship and becoming a safe place that they come for any type of medical response, by building that and having that interaction and having that safety spot, can really create a unique thing. And I think,
and I just want to add on what Kat is saying, because also when we talk about trafficking, most of the time we think about sex trafficking, but we have to acknowledge that labor trafficking is a big thing that is happening in New England, and that healthcare providers, they might have crossed with people that they've been labor trafficked, and something important is to build up their relationships. I know pretty much a lot of you guys know this already, but if people are listening, most of the time victims of human trafficking, they won't come and tell you, hey, I'm a victim, help me. But it's going to be the opposite, you know. They're so understanding the trauma bond that they have with their traffickers. So also building up relationships, I think healthcare providers could be that safe people that they might not be, even if they see the flags, sometimes they might not do anything, but just become a safe place, and time will let people to find that help and find that safe place for.
And I think that's also one thing that we're really passionate about, is breaking the stereotypes, because I think a lot of the education that it's been amazing has been focused in the last couple of years of focusing on women and children, mostly female children. But there's been really lack of education in like the LGBTQ. And then also, what does it look like? We had someone recently who, when we just put up a sign at a convention that says "We speak Spanish," it was really interesting, because we had flyers with all the red flags in Spanish and different things like that. And people were like, "Oh, I've heard about human trafficking," but when they started reading it, they were just like, "Ooh," and they started coming with these questions like, "Oh, my boss makes me work 60 hours a week and only pays me like $400. And they take away so much room, and they charge me Boston rent, and my husband is a construction worker, and here's what's happening." But we're like, when the construction worker goes to the ER or gets a work injury, are they really looking at that person, or as male survivor, how do we change that aspect where you're recognizing that, but also how do you change the aspect of what it looks like, what a survivor looks like, and breaking those stereotypes that people can actually be like, oh, something's off here. How can I create that dynamic, but also knowing, one, how to identify it, but also two, how to interact in a way that's really natural, that you can, maybe it could be frustrating because we've had providers be like, man, I knew this was something off. But being that safe person for that one time, maybe the next time they go to hospital, might reach out to you another time, creates that dynamic, or sets it up for another service provider who comes into in interaction with them. So I think that's why a long answer, but why we're passionate about the service providers, because it has to work in a network together.
Yeah. So you guys said that there is that lack of education with the providers, and I found research that only 13% of healthcare providers feel confident in recognizing that. So do you think it depends on the type of like physician, like emergency department compared to trauma or any other, or is it just kind of all together, do you think, collectively?
I would say that's collectively. Also, pretty much sometimes one thing that we've done, and I think also as we're talking about building up relationships with victims, I think also as service providers, we should build up relationships. Most of the time is like, just get 1 hour of how to spot human trafficking and here you go ready. And it's like, okay, that's not realistic, to be honest.
That's not enough training.
That's not enough training. So I think also as we are building up partnerships, training should be part of our like long-term trainings where we are working with task forces, when we are working with local coalitions, and that we are evolving constantly and working in a multidisciplinary teams, that we feel more equipped. I would say I can go give a 2 hours training,
Mm-hmm.
and I can say, well, you guys are ready. I already told you what are the flags, what's human trafficking. You're ready to go out in the world and find everyone who's been
Mm-hmm.
trafficked. But the reality is doesn't work like that.
Yeah.
And I always say this as like, I can read, I can be trained of how to swim, but
Mm-hmm.
until I jump into the water, I will know what it's to swim.
Yeah.
So I think that sometimes there's also this this disparity between what the book says and the
Mm-hmm.
scholar says and what the reality says.
Mm-hmm.
So I think also that's why we should have to work together with people and organizations that are put in the ground, working into this and creating these long-term partnerships.
And I think also, like I said before, it's pocketed, because I have to say, here in New England, there are 2 emergency room physicians in 2 major hospitals in Boston who are really, truthfully, national leaders in
Mm-hmm.
creating education and response, a really amazing survivor-centered response and educating physicians. And I think, but they're 2 people. And so who they're able to reach and how they've been able to change those
Yeah.
protocols and those responses, I would say Mass General has a really amazing response. Their doctors are incredible. And if I said, I feel confident that if I sent a survivor to that ER, they would have a survivor-informed response.
Mm-hmm.
But I think that's, and I would say some Boston hospitals that have been trained from these two physicians really have a lot of education, and they've been able to do different things in pockets around Massachusetts, around New
Mm-hmm.
England. So you have those things that have that education and that response. But I think there needs to be that continued education that continues, but also,
Mm-hmm.
that continued education, but also that practice.
Yeah.
And I think that makes a big difference. But I think when you move beyond the metropolitan areas,
Mm-hmm.
there is this huge gap of, I don't know what it looks like. And I think one of the things that's most important is that trafficking doesn't happen in just one region. And a same survivor can be in multiple different counties, can be in multiple different regions. They can be across New England,
Yep.
even within the same day. And so having wherever they could respond, and it might not also be a hospital, it could be a drop-in clinic,
Mm-hmm.
any type of clinic. Actually, most of the time, too, especially too, I've met some survivors who are like, they're training hospitals. They know that. My employer knows that. So therefore, the place I could go that's safe is a drop-in clinic, a day clinic.
Mm-hmm.
So I think educating healthcare providers and clinics as well at the different aspects of healthcare is super important.
And I still think we should have to build up these communities of practice with other multidisciplinary teams where I'm not expecting a doctor to be the human trafficking top experts, not all of them,
Yeah.
but have some basic knowledge, but have the relationships that if something comes, they know who are the people in the region that they can ask for help.
Mm-hmm.
And I think that's important too. Going into one other idea, I feel sometimes we are expecting some service providers to be Superman and be my experience working with law enforcement, sometimes we're expecting be detective and be social worker and be,
Mm-hmm.
and their job is just one thing,
Yeah.
and I think it's the same. Sometimes I wouldn't expect every doctor that takes a training become an expert, but what I would expect is that they have the policies in their hospital and
Yeah.
the resources that if something comes, they could walk with those experts. And I think that's also a big thing that I think we need in New England and all over the US.
And funny, I was just thinking the same thing. I think that knowing where your role ends, like as a healthcare, this is one of the things we say is, maybe as a first responder, or EMS, your response, you hand it over to that doctor or ER physician. Your job is maybe being like, hey, I don't know what this is, but in my gut, I feel like this. We always say, I'll use the example of missing children who return to care. They always go for medical clearance.
Mm-hmm.
I would say it's very few that or show up for different issues. But alerting the hospital, hey, this kid has concerns for exploitation, for trafficking, so they get the right medical follow-up, and making sure they get that. And sometimes that is just that one language of like, hey, that communicated from one person to the other will change the whole dynamic of how that survivor is treated. So they're not frustrated at the medical appointment where they're like, I walked in and I sat there for hours and this is a response. And the medical is seeing like this whole different response from this person.
Mm-hmm.
But I think by just transferring over that one piece of information, you don't have to know, but by saying like, I suspect this could possibly be, I don't have evidence of it. You don't need the evidence, but communicating that and passing it along can change the whole response and medical response for someone.
Another idea, Shelby. Hopefully, I'm not like giving information. You're like, oh,
Yeah.
this is overwhelming. But also, one thing I would say is like, yes, we can train people, but also within the healthcare systems, we have to train decision makers.
Yeah.
I've talked with multiple doctors that they are all in, they're trained, but if their healthcare network and hospital, they don't have the right policies. They are fighting against, like, they're hitting a wall.
Yeah,
They're
so
like,
it
yeah, I
all
would
just
like to do
depends
this.
on like the facility itself. Like Rhode Island
Yeah.
could be different than Kent and different than like
Yeah.
Massachusetts hospitals.
And I might have an amazing doctor that gets it and it's all well trained, but if the hospital where that person is working, they don't have the right policies, and we have trained the right people to create the systems and policies, I think that's also hard. So I think also we need to train healthcare, but also decision makers, and also train on policies and systems.
And I think also too, with that, it has to be a multidisciplinary approach within the medical system too. And so you have the ER doctor who they have a different role than a social worker in the hospital, but making sure they're both on the same page, that they can educate. Because if you have one or the other, because they're going to need very different roles and very different responses, and even a crisis and mental health response, that's going to be very different. And so you need all of those things within the same health system to be on the same. Even the OBGYN who responds, or the ultrasound tech, or radiology, you need all of those people to be on board in a really trauma-informed way that will impact the whole response. Because if you have just one person who's educated and someone else, because in the hospital you might see multiple people in that one visit.
Yeah. No, that's great information, guys. Thank you. So in your work, have you noticed any trends on like racial disparities in certain populations regarding access to care and treatment?
I wouldn't say like what I've seen. I wouldn't say I've seen like, I wouldn't say racial 100%.
Okay.
But I would say we still have same groups, like vulnerable groups, minorities, being vulnerable and have not access to services the way we want. I would say I've seen groups of LGBTQ, I've seen immigrant groups, people of color, indigenous, those vulnerable groups still being vulnerable and still having less access for resources and services with human trafficking and healthcare. I think one thing that I've seen is that the vulnerabilities and the traffic situation increase risk of people to access healthcare.
Yeah.
And even while they're being trafficked, their exploitation situation makes it harder for them to get this access. And I would say, yeah, like I would say, sadly, there are still groups in the U.S. that every single day they face a lot of barriers to get healthcare services, and sadly, I would say, are minorities. Yeah.
And I think following up what Oscar said is, I would think there are different places and jobs we've seen, there are racial disparities, and I think too it's also a cultural knowledge and an education knowledge of what it looks like within each cultural context and how it impacts each individual group of survivors, and providing that education and letting them know you have a right to access of healthcare. And it also maybe they're from the US or they grew up in the foster care system.
Yeah.
What does that look like? What does it look like for the survivor who might not be from the US? Educating them that they have a right or access to it. But also I think too, one of the disparities we see a lot is that there is an assumption of culturally how a response should be, or not really realizing. One of the things that I'll use as an example is that we educate on a lot. Someone who might speak Spanish, a lot of times they're like, oh, Spanish, and they come here, but they don't realize maybe when they come to the US, they're like, oh, I'll use the example of Mexico because we worked in Mexico. Oh, they're Mexican. Okay, cool. So you speak to them in Spanish, but what if they're indigenous? Their first language isn't Spanish. So they're maybe saying yes or no to things that they might understand 80% of what you're, or sound like they're responding appropriately.
Yeah.
But they're not, and they're not understanding. And so I think one of the things we challenge people to is understand the cultural context, but also like in the Asian massage parlors. But also I think there's a lot of training around the massage parlors and the survivors who are Asian, but what does it look like if someone is from a massage parlor and is an American citizen? Because there are. And so breaking that stereotype, and also when you get the education, the different type of massage parlors that exist, so that they're receiving same quality care, but also that they have access to care. And I think also the cultural context of what shame looks like, what trauma looks like, what the belief is about healthcare. Maybe do they understand different processes? Do they understand access to certain things they have rights to? Are there beliefs within, even though maybe they grew up in the US, are they from a certain region where culturally people believe a certain thing about one different response, or even different forms of birth control, or different types of things? There might, depending on where they grew up or what things look like, what they believe might be completely different, or what they've had for education. So I think there are definitely some disparities in access to care, but there's also a lack of providing people with real education, but also letting them know what their medical rights are. I think that's something really, when we respond with kids, we really try to have a conversation before you turn 18, or every time something happens to you. Do you know you have access to this medical right? Maybe not for now, but you have it for later. Or maybe this doesn't apply to you. And one of the things we do with adults too, and a lot of survivors, hey, maybe this doesn't apply to you right now, but if you have a friend that this information is helpful for, because I think we did a study, the two of us, and 95% of people that we interviewed and met with couldn't identify the risk factors themselves, but they could identify it in their friends. And so by using that friend example, you can get a lot of information and be like, hey, maybe this information isn't for you, but if you have a friend in the future, here's the right and access to, and here's who you can contact. So I think by providing that, but I also think a lot of awareness material isn't in the cultures or languages that people speak. And or maybe it's in written language.
No, I just want to. I'm sorry to interrupt you, but I just want to make an emphasis on people get to know their rights, because when we're talking about children, but what about when we are talking about people that, like, foreign nationals, where they don't have what's their rights, and I think that's super important, because even educating and create awareness on what people's rights have, and people might find, oh, I won't go to the healthcare because I don't feel safe there, but for them to know what are their rights, and I think that will create a, like, healthcare should become a safe place for them, where they go and feel that they are safe. And sadly, a lot of people, vulnerable people, they don't have that connection, or they don't think that. So I think it's important to create more awareness on people's rights, basic ones.
And I think even the rights aspect too is you can have adults who grew up, and I've worked with survivors as well, that were adults who grew up in the US, but they came from a state where, like, Massachusetts for years has had the rule of mandatory healthcare. But they've been in an exploitative situation that they didn't know that they had rights or access to healthcare, or they don't know that, hey, you're making no income, here's your rights or access to healthcare that you have that you can apply for nationally. You know, and I think putting that information into their hands when they show up to a clinic, or they show up to a different place, will help in a huge way, because I think that's a huge thing, is a lot of even our adult survivors connecting them with healthcare plans and insurance, and how to do that process, and that they have a right for certain things. And I think sometimes, especially maybe they're found here in New England, but they're not really, they're from somewhere else in the US, and them not realizing, like, oh, I have to be a resident to get healthcare. And so breaking down those barriers and putting that information in their hands to say, here's what it looks like, but also I'm going to help walk alongside you to get you that insurance, so you have access to mental health, that you have access to medical, that you have maybe all the different follow-up that you need, you have access to, but also what are the free programs that are available.
How do you think, like, you would get that message across to them so they know that they do have the access that they need?
I think
I think we're working on that. I mean, I don't know if I understood right, but we're working on that. I feel still there's a big need to find creative ways to reach that population, and we have to, as we were talking before, we have to be culture informed, even how we do our awareness and education, and how we reach those communities and those vulnerable groups. So I think that's still work to do. I feel we have to do it better, you know? And communicate that. But yeah, we're working on that.
And I think that it takes people being on the same page, like that multidisciplinary response. It takes people within that cultural context, people who are boots on the grounds, people who do outreach, people who have access, to these survivors and have access to them on the street, have access to them in the hospital, have access to them, but providing that material and in a way that's really natural. Like I said, a lot of times we've been really even educating a lot of providers, like, hey, have this conversation. Maybe this doesn't apply to you, but I just want to give you this information in case it ever applies to a friend. Using an interpreter to use that same thing if they need it for another language, and say, like, I'm just providing that education in small pockets, but it takes different people because they're going to come into different spaces. So providing that same education. So it takes people in multidisciplinary things that have interactions with survivors in different aspects to create that education and pass on that resource, or make sure the right person, maybe I might have them for a different reason, but I know that I can't explain fully all the medical response. But if I pass them on to our specialized nurse, in Massachusetts we use a lot the PD SANE program, they can have an amazing conversation that's confidential. Or I pass them on, hey, do you know what, there's this amazing clinic in Massachusetts that treats survivors. Here's the number to this person. They can have those conversations. There are medical people who are trained who can fill you in, who are survivor informed. Beyond that, but I can be that person that passes on and builds that like if there's that element of trust, introducing that other aspect for someone else.
Yeah, that's great. Do you guys think, though, with COVID right now, that things are changing and that there's more or less of cases of trafficking?
Well, that's a good question, actually. I think COVID didn't stop trafficking. I feel we might see more. We should be more aware about trafficking, but it's just because COVID highlight what was happening already. I think people are talking more about trafficking. We were talking before about education and information. I think also through COVID, we have seen a lot of misinformation about how trafficking looks like, and that's being super hurtful for the anti-trafficking movement. But I think what COVID has shown us and highlight our vulnerabilities, that they already existed, and might be that COVID just put them on the spotlight or increase them. So I think that's what COVID has done. It's been terrible on the survivor side. Also, it's been terrible in the anti-trafficking movement, because that creates isolation and has stopped a lot of actually awareness programs, like educations and trainings. That sometimes we can do soon, but not everything works that way. My answer would be, COVID has just shown us how vulnerable people are and has been put it on the spotlight. But I think trafficking, some sort of trafficking, or how trafficking happens, maybe it has increased more. I've seen more criminal, like more cyber cases. Of course, because we are more in a computer in a room, so for sure that has increased. But I still would think that COVID has spotlight a lot of vulnerabilities that we were not paying attention before. They are there, and it's terrible.
I think that's a question I've been wrestling with, because I think there's a lot of reports of like, oh, trafficking is increasing during COVID. And I think that's one of those questions. I was like, you know what, I think just like I said, there's pockets, right? So in the states, in the very beginning, where there were states that were still open or still mass events happening, they were moving there. So at different people, they were seeing spikes. And we have friends who work all over the country. They were seeing spikes in all these different cases, because here's open, and here exploitation is still happening in movement. And I think a lot of different cases, there's been more reporting. But one of the things I've just been wrestling with is like, is it really more increasing of exploitation, or is it that people are slowing down to actually report it? And I think too, a lot of anti-trafficking organizations have had time where the pace normally is like super fast, but COVID has created a drawback of what people would usually do. So the numbers in reporting absolutely are increasing. But my question before, and this is what we always do at training, is like, are really the cases increasing? I'm not really sure. Or were they already existing, and the reporting and recognizing is actually increasing? And so I think it's really hard to say, because even the numbers and research is so limited on what's really happening, and there's no national database that combines. Like, even if you look at the national hotline, you look at those numbers are only reported of numbers to the national hotline, but they don't include every county. They don't include the states. It doesn't, local cases, federal cases, the statistics between those are reported, but also there's so many cases that never make it to law enforcement that nonprofits get. So that doesn't include those numbers, and there's no actual research encompassing all that. So I think that major gap but what I think is awesome is that during COVID, a lot of groups had time to take back, and even myself, I wish I got to keep up with it, but there's a month when I was like, oh, I can analyze my stats because I have a little bit more time right now to breathe. And there were things that I was like, whew, man, how did I miss things that I paid attention to, bigger things, the smaller things? I was like, actually, these numbers are really bigger than what I really paid attention to.
But still, I just want to say, like, still, it's just like, yeah, we have to understand that there's so many cases, there's so many ways that they won't come as a human trafficking case, but if you're not well trained, you will miss that there's trafficking.
Yeah.
I won't say COVID increased numbers of trafficking, and there's no data about that, but like, I wonder how many of these domestic violence cases, I wonder how these other issues, once you get to know deeper, you find trafficking. So I would just say that I won't say there's enough information sometimes to say, oh, there's more trafficking or not, because I'm pretty sure that sometimes even I meet with so many service providers that they said, in my 20 years, 25 years of career, if I have this information, I think I would cross with a lot of cases that now with these lenses that I have would be trafficking. Back those days, I was just like, oh, there is just another runaway. There's another kid misbehaving, and they will never be able to spot trafficking. So I think also that's one thing we have to understand, that pretty much, and even on the law enforcement side, there might be cases, there might be things that come up not looking or under the trafficking carpet, but there will be trafficking when you do the job, and when you start finding, there will be trafficking. So it's hard.
And I think too, and that's my question is, did the trafficking cases increase or did the reporting? I know the National Center for Missing and Exploited Children, this year, in the months just from March to April, they had 106% increase of reports of online sexual exploitation. That's 2.2 million. I think that's what the statistic was, just in 1 month increase. And so the National Center, they're reporting this, but my question was like, are these and online exploitation, and even the methodology which in trafficking is happening in exploitation, changed during COVID, because there has to be a digital thing, and to meet all the different sectors and things like that, people who are creating exploitation were having to change their methods and changing different ways to respond to a COVID response. And that's not in an appropriate way, but they were changing their methods too. But so it's, even as anti-trafficking organizations, understanding how they're changing things, but keeping up with that during COVID. And so I think also one thing I can say is, like, that step back, even with service providers, there was a lot of cases that were really missed, and accesses for services for survivors that were really missed. But then I think on the other hand, there was a lot of increase in reporting and people paying attention to it, and a lot of through different webinars that were before would be in-person trainings, gave access to people all over the country information that they didn't have access to, and access to experts that they didn't have before. And so I think there were a lot more people tuning into some of those webinars that they didn't have access to, or a lot of organizations that usually charge were giving free webinars. So I think that change education, that makes me wonder, really research-wise, can I say yes or no? Are the numbers, or is the education increasing so people are reporting?
Also, I just want to go back and say something about COVID. As we see, there was great because people got more webinars and all that stuff. Also, there was a lot of misinformation. The last few months, there has been a lot of misinformation of how trafficking happens in the US, how trafficking looks like. So also, we were talking at the beginning about awareness and education. So I think COVID highlight how, like, there's a lack of basic 101 education in the general population. That during these months, we've seen a lot of reporting based on misinformation. So that's also kind of, I don't know, like people calling, oh, yeah, it's trafficking. Let's even how the hashtag Save the Children was used. It was terrible, because that also hurt anti-trafficking organizations. So that's also, I don't know, like, there might be a lot of reporting, but also there will be a lot of misinformation that people still don't know how those look, like how those human trafficking looks like in our communities.
And I think increased reporting, but also still a huge number that's actually being really missed. So it's that kind of, it's not hard, you can't really answer yes or no, because I think there really needs to be research. But I think the numbers of reporting wise, like that 106% reported the National Center for Missing and Exploited show them a 1 month jump is a huge deal.
This is not based on data. This is based on experience. But still, people be calling is like, oh, I see this white van running around my neighborhood. There's a trafficker that wants to steal my children. I'm like, I wouldn't say that doesn't happen like that, but 99.9 of the time, I would say trafficking looks like different in your community. So so just like get up about that. And I say that because might be the 0.01% is like, oh yeah, that happened. But there's a lot of education we still need to do.
Yeah. So throughout like your journey of research and like education wise, what has helped you like throughout all of it?
Can you explain like how has helped me to get more
like
research
what
and education?
resources like helped you throughout your journey of like doing your education awareness and like your research for like trafficking?
Well, one thing that's been super helpful for me, and I mean I think that's part of my expertise, is being boots on the ground and being first line, dealing with cases, survivors, and trafficking situations. I think one thing that it's always good that I would highlight for every researcher and every people is just highlight survivor voices and work close with survivor leaders in your community, that they would provide you a great information, but also I think they would serve as that bridge between what just scholar data says and what the reality of the streets tells you, that sometimes there might be something. So working with boots on the ground organizations is super helpful. People doing the job every single day.
And I think developing relationships, I think learning what works, what doesn't work. You'll make mistakes, but learning from them. But I think also too, like Oscar said, bring survivor voices, but not for your own purpose, for really serving and trying to bring a relationship with them, to build that trust that you're not another person that's wanting something or an exchange from them, but you're really there to help and support. I think for us, one of the things is that we have a lot of experience with people we love. And when I say we love, because I never felt like we were working before. There were people we really cared about, and they were invested in our life, we were invested in and so I think that changed the perspective. And I think having the perspective of, we didn't work just in one area or one region, but seeing different things and what things look like, but also being open that we don't know everything, you know. There's always something to learn. Things are constantly changing, things are constantly developing, but I think bringing the survivor voice to the forefront, but not in a way that's re-exploitive, because you want and also not a way that's forced, but just being like, what do things look like, but also sharing as a service provider, here's mistakes I made, here's where it's going, and here's what's real, you know. And I think sometimes there's that gap between what's written and what really is practical. And suggestions that are suggested as best practices might not really be practical for people who are implementing them. And I think also there needs to be a cultural adaptation and regional adaptation for any type of education program, because I think what works in a metropolitan area looks very different in a rural area. Even how things work, how people respond. And so even within the same state, knowing it's okay to adapt things in your community is really important, because it's going to look different. And you don't have to sometimes you try to replicate what everyone else is doing, but you have to creating an individualized response that really fits the people that who are working there, that fits their character and personalities, that can actually be implemented, but also a realness to the response is a huge thing.
And I would just say, and I mean, I love data. I work a lot with data, and all my data people, hopefully they don't hate what I'm going to say right now, because I love data and my data people. But there's so many things we don't know. And honestly, there's no data. So as we are learning, we have to keep building. I think we are in a stage that we cannot say like, there are some issues, other social issues that we've been researching and creating data for the last 100 years. I think, and again, maybe my data is wrong, but I think not every state in the US has like a human trafficking law since after 2012. So we're pretty new into this. So just understand that not all data is just like the Bible that you, I mean, it's using that, oh, this is what the number says, and we have to be, no, let's be flexible and let's understand that not everything works. Like, or some data we don't know, so we have to start building up and building real data. So I think I'm glad, and I love that there's more like seriousness on how we create data that really are showing us how does trafficking looks like, because still there are a lot of things we don't know.
Yeah.
And I think too, recognizing that everybody is going to have an individualized response. And that's what I think we saw. We have some of our kids who when we were working in Mexico had the same exploiter. Some of our adults did as well, and their response and their memories to certain things were very different than the other person's, and their interactions and their triggers. And I think one of the things that I always say is, no, it's not about you. Like one time I had a child say to me, I can't be near you, you have green eyes and you're American. The person who purchased them was. And so I think knowing it, like, okay, there's something triggering about me that has nothing to do with it, but always work in tandem where you could pass it off. And I think another time too, one of the things I learned, and I mean, we work together very often and we work together for over 14 years, is I think so many people were like, oh, you need a woman to respond. No, a woman might be triggering. A male could work too, you know? And so I think breaking those stereotypes of how we think the response should be, because you don't know what an individualized person is, but knowing when it's maybe there's something you don't know what's going on, it has nothing to do with you, but knowing where your boundary, no matter how much you want to step in and how much you want to help, but knowing like, hey, this isn't about me. As much training as I have, as much awareness I have, I need to take a step back, because something about me might even be just the way I look or the tone of my voice might not be healthy for someone else. So knowing when you're like, this is my boundary and this is where things go, but this is where my role ends, and when to take that step back, I think has been super helpful. And sometimes it can be heartbreaking, but also knowing that you're part of someone's story for a period of time, and it's important to connect with other people and have that network so you can pass it off to someone else who can fulfill that role. And that looks different for everyone.
And just adding on what she's saying, I would say like it's super helpful if you're working in the field of human trafficking and the service provider aspect to realize it's about humans, it's about people, it's about stories. It's not just like, I mean, I love that, again, I said, but sometimes that we can feel it's really impersonal. So just understand that we're not dealing with data, we're dealing with people. And we as human beings are so complex. So.
Yeah. So if you guys could provide like one piece to myself or someone who is focusing their research on human trafficking, what would that be?
I would say there's a lot of, I mean, I love it. And again, we have, I think we have specialized our efforts on child sex trafficking, but still and I agree we should keep doing it. But I still, while we have been doing that, sometimes we haven't pay attention that there's also other forms of trafficking and other groups being trafficked. I would say there should be more research on labor trafficking. There should be more research on male victims of human trafficking. I think there should be more data, and we should pay more like our efforts on find how trafficking happens in Native American indigenous groups. I think that's something that I would say we still need a big efforts to put.
And then I would also say, as you research, I mean, try to connect locally, but try to look for different groups that are doing different things to get an overall perspective of what's happening. And maybe look for opinions that differ from your own. Because I think in the anti-trafficking world, there's a lot of opinions. And there's a lot of different methodologies of how people think they should be, but looking at those different angles. But I think you don't want bias research, but I think taking it just not from the lens of just a researcher, but trying to fully understand what things are and what things look like. Because I think there's some amazing research coming out now, but I think that's one thing we've battled as we've done our own research, but also there have been times where we've been at presentations nationally and we're like, what? And there's a big group of us like, that's not practical. You know, and I think so being open to really see who's the boots on the ground, because there are a lot of small movements and there are people doing really amazing things, but also knowing that your purpose of meeting them isn't for your own purpose. And interacting is to learn, you know, and I think it's really important, but also knowing in research, maybe there might be something shared that you might have to come back and say to them, especially in the survivor context, you said this to me during the interview, or you shared this with me on my podcast, or you shared that, but is that something that maybe verbally came out that you really it's part of your individual story.
Mm-hmm.
But giving them freedom to say, maybe I'm researching this and maybe I'll use this in my research, and you feel okay with it now. If you're ever at a point later on
Mm-hmm.
that you're not okay with this, giving them that freedom, it stinks because you're a researcher and you might publish something, but giving the survivor the freedom to say, like, years down the road, maybe I'm not okay with that. Maybe I'm at a different point where that's not we have friends whose stories are out there in different perspectives, and now they're at different points of their life, and they're like, man, my child Googled my name and that's what popped up.
Yeah.
And so, but they feel like I'm stuck. So I think one of the things important in research too is that, especially if I work with survivors, is giving that freedom to say, you know what, this is part of my research, but you always have the freedom for me to take that out.
Mm-hmm.
I mean, hopefully this is practical too, but I would say just what Kat, she was saying about highlighting people doing puts in the groundwork, try to find the people. I know, like, if you're doing research, you have to follow certain methodology, but still, like, I'm telling you, I've met with 80-year-old like religious woman that they are like, they provide you intel, like they're like FBI, CIA agents, because they've been doing in that community the work for the last 50 years, that they can tell you everything on a situation. So I would say always highlight those voices and connect with them, and collaboration. That's super important.
And I think not judging, because I think sometimes a lot of it could be and it could not be, but the organizations who are flashy and doing things might not be, like you said, we had that 80-year-old lady for 50 years and she knew the insides and outsides of every aspect.
Yep.
Could tell you all these different things. She knew the exploiters, she knew everything, and but giving her a chance that, like, she just was one woman serving, and she had an amazing impact, but also breaking the stereotypes of, man, there are small people who aren't flashy, who aren't in the news, who are really doing incredible things. Finding the mix between that and the different perspectives is really important.
Okay, so I that's all I have for questions, and I would like to thank you both for joining this episode with me. If my listeners would like to learn more about the topic, you can check out Health Chat with Shelby on both Instagram and Facebook, and a big thanks to all you guys for listening to my episode. Thank you.
Thanks, Shelby.